We have been celebrating Heart Month all through the month of February, and we continue today with a visit with IRMC cardiologist Dr. Edward McDowell joining us on the phone this morning. Dr. McDowell, good morning to you.
Hello, Todd. Good morning.
Good to have you with us. Our conversation brought to you by Marcus & Mack, a law firm representing injured people. Heart Month is in February. I don't know why we choose February as a designated month for anything, because it's the shortest month of the year, and it seems like there's more than adequate information to talk about. But let's break this down a little bit and talk about your work as a cardiologist and what a cardiologist is, because I think that's a good place to start for people who really, when we stop and think about it, we don't go visit the doctor as much as we should, and we certainly don't visit the cardiologist unless it seems as if it is called for because of some sort of heart event. So let's talk first about what a cardiologist is and what a cardiologist does for people.
Okay. So cardiology is one of the subspecialties of internal medicine. So as far as training goes, you'll typically do a residency in internal medicine and then an additional 2 or 3 years in cardiology. Now, our newest associate, Dr. Frazier, who you'll be mentioning later on, she has an event later today, has additional training as a cardiac electrophysiologist, which is a big fancy word for heart rhythm problems. Mm-hmm. So cardiologists do non-invasive and invasive type testing to diagnose heart disease, treat rhythm problems, congestive heart failure, that sort of thing. About 3 or 4 years ago, we opened an interventional cardiology program here. So we have a full-service cath lab and can perform coronary stenting and balloon angioplasty when the patient needs that.
And when we stop to think about that, then after we learn that information, the natural question, I think, becomes, do I need to regularly visit a cardiologist, or is it more event-driven?
Well, that's a good question. And, my focus, and I think a lot of the focus for February, for Heart Month, should be on prevention. And that's a very important part. It's just so much better to prevent heart problems than to try to patch them up afterwards. The majority of cardiac problems are probably better initially evaluated by a person's primary care doctor. And so I think it should be a rare situation when a person sits down and decides, I want to go see a cardiologist. Now, a different scenario might be if someone moves to our community and they had something major like a valve replacement or bypass surgery, and they had a cardiologist where they lived before. It's probably all right in that case to just initiate a call to a cardiologist. Mm-hmm. However, in most cases, I think it's better to check with your primary care doc and find out who would be the best person to treat your cardiac needs.
All right. So when we think about our heart health, we think as well that, and this might be mistaken, but we generally think that as we age, the probability of having heart difficulties from lifestyle choices or family history might increase. Would that be a blanket statement that is true or partly true, or how would you characterize that?
Well, most of those things certainly do increase the risk. I mean, if you smoke for 30 years, the risk is much higher than if you've only been smoking for 2 years. So, yes, the effects can be cumulative. Another important factor is that the risk factors really multiply each other. So if a person has 3 or 4 risk factors, their risk of developing coronary artery disease is immensely higher than someone who only has 1 risk factor. And, of course, when we talk about the risk factors, first and foremost is smoking. The second level includes obesity and inactivity. And then, of course, diabetes, high blood pressure, and high cholesterol are 3 of the disease states that increase a person's risk. Family history is also a risk factor, but of course that's the hand you're dealt. There's not a lot we can do to change that, but it is one additional risk factor to consider. So yes, the risk of developing problems does increase with age.
One of the other things that occurs to me is that as we do age and the normal aches and pains that we feel, they might be easy to ignore because you say, I'm just getting older, and that's just something that happens. You fall asleep and you feel fine, you wake up and something hurts. When you are monitoring your health and you feel a pain here or there, I'm sure there are certain signs that might indicate that, this is a time to go get something checked out. This might be something related to my heart. What would those signs be?
Well, certainly if there's a change, and that's one of the problems that I think you touched on there. A lot of these things occur so gradually that we don't really notice a break point. All of us develop some arthritis with age and are a little stiffer than we used to be, and things just don't move as well. So certainly a change in pattern should get your attention. In general, too, most cardiac symptoms tend to occur with exertion. So any sort of symptoms that occur whenever you're climbing stairs, shoveling snow, things like that should get your attention. Doesn't mean you need to panic and rush to the emergency room, but that might be something that you want to talk to your primary doctor about, your family doctor.
You mentioned the interventional cardiology program at IRMC, and the technology advances in the last 20 to 25 years are amazing. Probably to you in the last 5 or 10 years, they're just incredible. But as we think about what used to be open heart surgery for blockages, then they became balloon angioplasties, bypasses. Of course, we used to talk about bypasses all the time. Nowadays, we talk more about stents than anything else, don't we?
Yes. Now, it is important to know stenting has not replaced bypass surgery, but there are certainly a large number of lesions that can be treated with a balloon angioplasty or a stent. Another area, off subject a little bit here, is that aortic stenosis is such a common problem. That's a thickening and calcification of the aortic valve. In the past, when it got severe, that always meant open heart surgery. But there is now a less invasive procedure called transcatheter aortic valve replacement that really reduces the hospital time and the recovery time. So yes, as time goes on, and this is true of other areas too, general surgery, orthopedic surgery, robotic surgery, endoscopic surgery, we do get better as a profession with making some of these procedures less invasive and easier tolerated.
Tell me about aftercare, particularly as you're concerned. If someone has a heart attack and is on the road to recovery, or somebody has had bypass surgery or some other sort of procedure to better their heart health, cardiologists becomes even more important, don't they, in their life?
Oh, sure. And that's probably a very important time when you do need to be seeing a cardiologist. And also we have an excellent cardiac rehab program here, which helps people recover. They had to close down a bit like everything else because of COVID, but they're open again, and that is also something that helps with people's recovery. So many times, if you get an artery stented, there are some new medications that need to be monitored. And so that's why aftercare is very important, particularly when people have had big procedures.
I would think so, that people might believe that after they have had that heart attack or that heart procedure has had to have been done, that they think they're going to have to walk on eggshells for the rest of their life because the least exertion or stress or problem in their life is going to cause them heart difficulties. And while that might be the case for some, that doesn't have to be the case, does it?
That's exactly right. And a lot of people do become very overly cautious. Any little pain between their belly button and their jaw, they think, oh, I'm having the big one. And sometimes spouses worry about the other, So now, this is not just the cardiologist, but I think the family doctor plays an important role in helping a person adapt to bypass surgery, stenting, valve replacement, and helping them get back into their life. No one knows you as well as your primary doctor, and so that's always important to keep in touch with them, even recovering from major insults.
We are talking with Dr. Edward McDowell this morning. You recently moved, well, maybe not so recently, but in the last several years, you have moved your office location, have you not?
Yes, we've been expanding, and parking was a bit of a problem downtown, especially for older folks. So we're out in the 119 Professional Center now.
Very much easier to get around.
We're up to Right. We're up to 4 cardiologists and 3 physician assistants, and we're probably going to expand even more. So we kind of outgrew our other space.
Does it pretty much excite you as a cardiologist to see the advances and to see them come to Indiana, whereas in the past you might have had to go to Pittsburgh to get some of the advanced treatments that you're now able to get here?
Oh, you're right, Todd. That's just been remarkable. And you had mentioned 20 years before. Well, my career is more like 45 years. So the things that I've seen that we couldn't help people with before is really just amazing. And you're right. It took a lot of work on the part of the hospital, not on my part, to build the interventional program that we have. And that was a major step. That was a major improvement in providing care, particularly because when someone is having a heart attack, they need attention right away. And so transferring the patient out, even by helicopter, adds a delay to getting that artery open. And that's probably the biggest service to the community that interventional cardiology has provided.
Yeah. That partnership with Butler is very, very important too, isn't it?
Yes. We decided we wanted to do this with a tertiary care center and someone who could do our bypass surgery, valve replacement, that sort of thing. And Butler, they're an independent community hospital like we are, and it's been a very good relationship. Yeah. And that may even grow more in the future.
Well, that would be terrific to see. It seems like it's just a marriage made in heaven there. We're talking with Dr. Edward McDowell. Now, we mentioned Dr. LaToya Linton-Frazier and the event that she has tonight. It's one of those You're the One in 2021 events. You can learn about preventive measures for heart disease. She'll host a beginner pop Pilates class to get your heart moving tonight. The beginner Pilates class will include 15 to 20 minutes of low-impact exercise, stretching, and core. Don't need anything besides water, yoga mat, or carpet, and breathable clothing. It's a virtual event that is happening tonight, and you could be entered to win an Apple Watch. And all you need to do is go to indianarmc.org, and right there you're going to find this event. It's Heart Health Virtual Chat and Pop Pilates with Dr. LaToya Linton-Frazier tonight. Dr. Edward McDowell, thanks so much. This has been good. I appreciate your time.
Well, thank you, Todd. And I do encourage people to participate in Dr. Frazier's event. She's a great young physician, and I hope a lot of you get to meet her.
Yeah, absolutely. It's a good thing. Dr. McDowell, have a wonderful day today.
Okay, thank you, Todd.
Bye now. It's a good conversation, and he's very, very articulate on the